Good afternoon, everybody.
Good afternoon.
Thank you all for being here. I'm here today with Council President Dan Brady to announce Phase 1 of the Cuyahoga County Opioid Crisis Mitigation Plan. In 2017, Council President Dan Brady, Prosecutor O'Malley, and I decided to file our opioid lawsuit against corporations that put their desire for profits over the health and well-being of the entire community. Virtually every aspect of our county government is suffering the consequences of this plague. With this lawsuit, we hold these companies that have caused such devastation accountable for their actions. And we're working to recover some resources necessary to pay the costs, which we've already incurred and are likely to incur for years to come. As we'll show at trial, those costs for Cuyahoga County alone are likely to run in excess of hundreds of millions of dollars. Our systems are severely impacted. Our children and family services, our healthcare system, legal system, justice system, job and family services, our medical examiner, and others have been overwhelmed by the impact. Let's take our children's services. When a parent dies as the result of an addiction, we often must take the children into our custody. We have record numbers of children in our care, up to almost 2,900 kids this week. That's the most in a decade. Our costs for board and care of these children are skyrocketing. Costs to care for one child can run over $85,000 a year. In 2019, we've seen our costs rise $9.6 million, and next year we're anticipating those costs to increase by $10.7 million more. And that's just for 1 year. Or consider the costs for residential treatment beds. There are thousands of people in the county who are addicted as a result of the opioid epidemic. They need treatment services. There's a terrible shortage of residential treatment beds. For one bed, for 1 year, the cost is about $78,000. Multiply that by thousands of people over the next decade, the costs are out of sight. Cuyahoga County has so far received cash of about $23 million, not $60 million, from 4 defendants. That's one-time money that won't be repeated. Compare that to our hundreds and hundreds of millions of dollars of costs. Anyone who suggests that somehow $23 million is a windfall just doesn't understand the catastrophic impact of this opioid crisis. Working with many of the people you see standing here, we're developing a short and a long-term opioid crisis mitigation plan to use the funds from the settlements and the trial to directly address the tremendous needs of our community resulting from this crisis. We're working with all those here today and many others who are not here, unfortunately, but wanted to be. This is truly a regional collaborative effort. Today we're announcing Phase 1 of the plan. This comprehensive plan is investing our funds in evidence-based, impactful, sustainable programs with a focus on prevention, treatment, and recovery. Following are the recipients of Phase 1 funds. The Thrive ED program, Thrive ED program, will provide $3 million to hospital emergency rooms to extend the Thrive ED program. Thrive ED is an innovative program linking individuals in an emergency room that survive an opioid overdose for immediate withdrawal management, treatment, and other recovery support services. Currently, Thrive Ohio certified peer recovery coaches are located 24/7, 365 days a year in the Metro Health Emergency Room. These funds will enable us to continue the Metro Health program and to offer these same services to hospital emergency rooms throughout the county. University Hospitals and the Cleveland Clinic have committed to launching this program throughout their systems, which will put this program in most of the emergency rooms in the county. We're also putting $2.5 million in for diversion programming. Too many of our residents who suffer from addiction and mental health problems are in our jails. This is not how it should be. We need an approach that gets to these folks the treatment they need outside of the jail setting. We anticipate creating a diversion program in 2020, and we're providing $2.5 million as an initial investment. The impact to our systems has been and remains huge, including the impacts to our justice system. In this plan, we'll fund an additional $1.1 million to the prosecutor's office for 4 additional prosecutors in the Children and Family Services Unit so that we can better support the growing caseload. This money will also fund 2 more crime analysts. The crime analysts study crime trends related to opioid distribution and trafficking. They also work with local law enforcement to try and stop crimes before they occur, or better prepare law enforcement to stop crimes such as drug sales before they occur. This plan also expands the drug court. The goal of the drug court program, which began in 2008, is to break the cycle of recidivism by addressing an offender's drug dependency. With this plan, the county will fund an additional 4th drug court docket. The docket would serve the high-risk multiple conviction clients that don't qualify for the existing drug court dockets because of program requirements and limitations. And the plan adds more clinical assessors to support the drug courts. Currently, the drug court suffers from a weeks-long backlog regarding clinical assessments, which results in offenders waiting in jail for weeks, awaiting their assessments. The medical examiner's office is critical to the work of the justice system and has obviously been hit very hard by this crisis. The plan provides more funds for new toxicology testing and instruments and new personnel, including 1 full-time epidemiologist and 1 social worker to work with families who have lost loved ones and to connect them to services. And of course, the impact on our families and children has been devastating. As I mentioned earlier, we have record-breaking numbers of children in our system, more than in a decade. We're using some of these funds to add more capacity to one of our most successful programs called START. START, which stands for Sobriety, Treatment, and Recovery Teams, will receive $3.5 million. The START program pairs moms who have addiction issues who might need intensive treatment in order to stop them from relapsing with teams of specialists. We found that mothers in the START program are almost twice as likely to successfully get and stay off the drugs than moms not in the program. We're also going to be adding $1 million from these funds to help cover the skyrocketing costs for children in custody due to the opioid epidemic. In total, the county is spending about $54 million in board and care for the children in our custody. We also wanted to make sure that we address the problem of drug addiction by educating our children with proven, impactful programs. We'll provide $300,000 to the Family and Children First Council to administer a National Institute on Drug Abuse K-12 educational program. That's a lot, but there's more. I'd like to bring up Council President Dan Brady now to give you some more detail. Council President, I will say, has been an invaluable help. He's worked very hard together with us to understand how to best distribute these much-needed funds, and he's come up with some wonderful suggestions. Thank you.
Thank you, Mr. Secretary. Thank you and good afternoon. The impact of the opioid crisis in our county has been devastating. Metro Health and the Adams Board have been on the front line of this crisis. We will be providing an additional $5,433,000 to the Adams Board. The Adams Board will use these funds for the following services: increase residential treatment beds for people who are in need of intensive 24-hour support and inpatient services. With these funds, they will be able to serve approximately 260 additional clients. We are also going to fund partial hospitalization and intensive outpatient programs for 312 more people. Through the Adams Board, we will provide an additional $2 million to the St. Vincent Charity Rosary Hall, which has been on the forefront of treating drug dependency for 60 years. These funds will expand outpatient services. Unfortunately, many of those in the county jail are suffering from addiction. We want to increase capacity to help them. We are adding an additional $1,772,000 for Metro Health to treat and serve addicted inmates at the county jail. Metro will identify individuals with addiction problems and will treat these inmates using specially trained medical professionals focused on treatment, substance withdrawal, and suicide prevention. Metro will also receive another $931 million to create an opioid treatment program unit at the jail, which will be federally licensed to treat opioid use disorder. This plan was created with the help of experts from the Metro Health System and the Adams Board. I'm very pleased with this first phase. Mr. Executive.
Thank you, Dan. By the way, that's 931,000, not million, just so you. We received a lot in settlements, but not that much. As you can tell, this is a substantial plan, and a lot of people have helped us put it together. We couldn't have done this without the support and input from the people you see standing here, so I'd like to thank them by name if I could. From University Hospitals, Jean Lackamp, Dr. Jean Lackamp, the Director of Pain Management Institute, and Ryan Marino, Doctor, Department of Emergency Medicine. I'm sorry if I get any of these names screwed up. Apologize. From Metro Health, Dr. Julia Bruner, Physician, Executive, and Correctional Health Medical Director. Dr. Joan Papp, Director of the Office of Opioid Safety. From the Cleveland Clinic, Dr. Judith Welsh, Emergency Services. Pam Holmes, Executive Director of Government Relations. From St. Vincent, Jan Murphy, President and CEO. Dr. Ted Perrin, Co-Medical Director of Rosary Hall. And many sisters in leadership from the Sisters of Charity Health System. Adams Board, CEO Scott Osicki, Judge Joan Sinnenberg, Dr. Tom Gilson, the medical examiner, Walter P., we call him, Director Health and Human Services, Cindy Weiskettel, Director of Children and Family Services, Bill Mason, Chief of Staff, and Robin Martin, Director of Families and Children First. So if I could just take a minute and thank all of them very much. As you can see, this is a robust program, and we really, Dan and I worked hard on this, but we couldn't have gotten anywhere near where we are today without the help of all these great people. You all made this happen. Thank you very much. This crisis will not be abated overnight. It'll take a sustained, multi-year approach that focuses on where the greatest impact can be made, so we can ensure the epidemic is fully and finally stopped. We're committed to using these sorely needed dollars wisely. The truth is, the needs are much greater than we can fund with this $23 million. It's our hope that our trial is successful and leads to more funds so that we can treat those who are addicted, allowing them to conquer this terrible disease and become productive members of our communities. We want to help people get their lives back, and there are thousands who need our help, from mothers who are trying to hold their families together, to children who have been exposed to opioids, to the construction worker who is prescribed opioids to treat his on-the-job injury. This epidemic knows no bounds, as it affects men, women, and children across our community. The toll has been terrible. Most of us know someone who's died too soon. With this plan, we continue and strengthen the work that so many have been doing to save and change lives. Thank you all very much. If anyone has any questions, I'll turn it over to If anyone has any questions, Council President Brady and I will try to answer them.
One question I had off the bat was, like you said, this is one-time money. So for the positions you're funding, what do you do when the money runs out?
The intent is to get the money out as fast as possible to the places it needs to go. We have to make this sustainable, and there's different options to do that. We have a trial coming up in a couple weeks, and we're hoping that the results of that trial will allow us to make these commitments sustainable. Otherwise, we'll have to find other means to do so. But we intend to do that.
Is there any concern?
Council President, you want to add anything to that?
Oh, I was just going to say, you know, you've got so many different organizations that provide services. Is there any concern that there's just no way to spread the peanut butter thick enough here because you've got so many places that need it?
Well, there are always more needs than there are resources. That's not something special about today. So, of course, there are. We will have to be focused to use this money in the very most effective way that we can, and we're committed to do that.
And I would not use the phrase spread peanut butter. This is definitely not spreading peanut butter. We have focused on those programs that have proven to be successful, either here in the county or elsewhere. If we had more money, we could add more programs. This is not spreading peanut butter. This is directing, focused the money on the places it needs to go.
One other thing I wondered was, how are you splitting the cash that you've received? Do you have an agreement with Summit County about how you split it?
Yes, we've the $23 million that I referred to is the money that we received from those settlements. You've seen references to higher numbers. Those higher numbers are because part of that is being split with Summit County.
I know they're also making drugs available in some of the settlements. What are the plans for those?
Yes, we've received $23 million in cash. We've also received some additional products from some of the defendants that have settled, and we are making those available to the people behind us that need those products. Anybody else? Well, we answered all the questions, I guess. All right.
We've got a
Any
lot.
last-
This is a great beginning. We've got a lot of work to do, and we're counting on all the folks behind us and everybody here who cares to help us do that and continue this, because it's a big job. And hopefully, in a few years, we can turn the corner on this opioid crisis.
And I'll just close by saying that the people here behind me have been working in the trenches for years. This is not something that they're just starting. So we're very pleased that we were able to support their efforts in a way that we haven't been able to in the past. I agree with the Council President. I think this will enable us to turn the corner on this. Thank you very much.